In today's discussion, we're exploring 5 commonly prescribed medications that, while effective in the short term, carry potential risks when used over an extended period. Many healthcare professionals advise caution or even discourage long-term reliance on these drugs due to side effects that can be as problematic as the conditions they're meant to treat. Understanding these risks empowers us to make informed decisions, relying on these medications responsibly and exploring alternative, non-pharmacological options whenever possible. Let's dive into these medications, the potential hazards associated with their prolonged use, and how you can manage your health with or without them. 1. Proton pump inhibitors, PPIs, stomach acid reducers. Proton pump inhibitors, or PPIs, like omeprazole and pantoprazole, are primarily prescribed to reduce stomach acid production. They're often used to manage conditions like GERD, gastroesophageal reflux disease, stomach ulcers, and chronic heartburn. However, many doctors are cautious about recommending them for long-term use, as evidence suggests that prolonged use may lead to several health risks. Nutrient absorption issues. PPIs can interfere with the stomach's ability to absorb vital nutrients, such as vitamin B12, magnesium, calcium, and iron. This can have serious implications. Vitamin B12 deficiency, for instance, can lead to neurological symptoms, including memory issues and mood disturbances. Magnesium and calcium deficiencies, on the other hand, may contribute to osteoporosis, increasing the risk of fractures. Studies have shown that people on long-term PPI therapy have a notably higher incidence of hip fractures, particularly in older adults, due to bone mineral loss. Increased infection risk. The stomach's acidic environment serves as a natural defense mechanism, killing harmful pathogens we might ingest. PPIs reduce stomach acid, making the body more susceptible to infections like Clostridioids difficile, a bacterium that can cause severe diarrhea and even life-threatening complications. Reduced acidity can also increase the likelihood of respiratory infections, such as pneumonia, particularly in hospitalized or immune-compromised patients. Potential kidney damage. Emerging research suggests a link between chronic PPI use and kidney problems. One study found that long-term PPI users had a higher risk of developing chronic kidney disease, potentially due to recurring inflammation or decreased blood flow in the kidneys. Although the exact mechanism is still under investigation, the correlation has raised concerns. Alternative management strategies. For those with acid reflux, lifestyle changes can be highly effective. Avoiding large meals before bedtime, limiting acidic and spicy foods, quitting smoking, and maintaining a healthy weight can significantly reduce symptoms. In cases where PPIs are necessary, healthcare providers often recommend using the lowest possible dose for the shortest possible time to mitigate long-term risks. 2. Non-steroidal anti-inflammatory drugs, NSAIDs. Pain relievers. NSAIDs like ibuprofen, naproxen, and diclofenac are widely used for pain relief and inflammation reduction. While effective in managing pain from conditions like arthritis, headaches, and muscle strains, extended NSAID use has been linked to a range of potential side effects. Cardiovascular concerns. Long-term NSAID use, especially at high doses, has been associated with an increased risk of heart attack, stroke, and other cardiovascular problems. This risk is especially notable in individuals with a history of cardiovascular issues. One analysis of large studies found that regular NSAID users had a 20% higher chance of developing cardiovascular problems, with higher risks among those taking prescription-strength doses. Gastrointestinal issues. NSAIDs can be harsh on the stomach lining, leading to ulcers, bleeding, and in severe cases, gastrointestinal perforations. These issues occur because NSAIDs inhibit enzymes that protect the stomach lining, which can lead to erosion over time. While taking NSAIDs with food may reduce stomach discomfort, it doesn't eliminate the risk of gastrointestinal complications. Kidney damage. NSAIDs can restrict blood flow to the kidneys, impairing their function. Prolonged use can increase the risk of chronic kidney disease, leading to conditions such as hypertension and fluid retention. In some cases, NSAID-induced kidney damage may be irreversible, especially in older adults and those with pre-existing kidney issues. Alternative pain management approaches. Physical therapy, exercise, and alternative methods like acupuncture or chiropractic care can provide pain relief without the side effects associated with NSAIDs. Additionally, cognitive behavioral therapy, CBT, has shown promise in helping individuals manage chronic pain by altering pain perception and coping strategies. 3. Statins, cholesterol-lowering medications. Statins, including atorvastatin and simvastatin, are frequently prescribed to lower cholesterol levels and reduce the risk of heart attack or stroke. While statins can be life-saving for individuals with high cardiovascular risk, their long-term use raises some concerns, particularly for those without established heart disease. Muscle problems, muscle pain, stiffness, and weakness are common side effects of statins. These issues can range from mild discomfort to severe conditions like rhabdomyolysis, a rare but serious form of muscle breakdown that can lead to kidney damage. Increased diabetes risk. Research has shown that statins may elevate the risk of developing type 2 diabetes. This could be due to the effects statins have on insulin sensitivity and blood sugar regulation. Although the risk increase is generally small, it's more pronounced in those who are already at high risk for diabetes. Cognitive effects. Some statin users report memory issues or confusion. While these cognitive side effects are typically reversible upon discontinuation, they can be distressing and impair quality of life. Alternative strategies for cholesterol management. For individuals with elevated cholesterol but no history of heart disease, lifestyle modifications can sometimes replace or complement statin therapy. Dietary changes, such as reducing saturated fats, increasing fiber intake, and incorporating heart-healthy fats like omega-3s, can significantly lower cholesterol levels. Regular exercise, weight management, and stress reduction are also essential in maintaining healthy cholesterol levels. 4. Sleep medications, zolpidem and other hypnotics. Sleep medications, such as zolpidem, Ambien, are often prescribed for individuals struggling with insomnia. While effective for short-term sleep issues, long-term use can lead to various risks. Dependence and withdrawal. With regular use, individuals can develop a dependence on sleep medications, which makes it difficult to stop taking them without experiencing withdrawal symptoms. Rebound insomnia, where sleep issues worsen temporarily after stopping the medication, is common. Cognitive impairment. Hypnotic medications can cause residual effects like daytime drowsiness, dizziness, and memory problems. This increases the risk of falls and accidents, especially in older adults, who may also be more susceptible to cognitive impairment from these drugs. Unusual behaviors. There have been reports of people performing complex behaviors while not fully awake, such as sleepwalking, cooking, or even driving. These behaviors can be dangerous, not only for the individual, but also for those around them. Alternative sleep management techniques. Cognitive behavioral therapy for insomnia, CBTI, is a highly effective, non-drug approach that can help individuals improve their sleep quality and duration without medication. CBTI focuses on changing sleep habits and attitudes towards sleep, helping individuals develop a healthier relationship with rest. Other strategies include setting a consistent sleep schedule, reducing caffeine intake, and creating a relaxing bedtime routine. 5. Anticholinergic drugs, various medications. Anticholinergic drugs are used to treat a variety of conditions, such as overactive bladder, allergies, depression, and even some symptoms of Parkinson's disease. While effective, they are associated with a range of side effects when used long-term. Cognitive decline. Anticholinergic drugs work by blocking the action of acetylcholine, a neurotransmitter essential for cognitive function. Prolonged use has been linked to an increased risk of dementia and other cognitive impairments. In fact, studies have shown that older adults using anticholinergic medications for extended periods face a significantly higher risk of memory problems and cognitive decline. Physical side effects. These medications often cause dry mouth, blurred vision, constipation, and urinary retention. While these side effects may seem minor, they can be particularly troublesome for older adults and may contribute to falls, dehydration, and other complications. Alternative approaches. For conditions like overactive bladder, behavioral therapies such as bladder training and pelvic floor exercises can provide relief without the risks associated with anticholinergic drugs. For allergy management, non-anticholinergic antihistamines are available that do not carry the same cognitive risks. While medications play an invaluable role in managing many health conditions, being mindful of their long-term risks is crucial for maintaining overall well-being. Understanding the potential side effects of these 5 medications can help you make informed choices, whether by adjusting dosages, exploring alternative therapies, or implementing lifestyle changes. Proactively addressing the underlying causes of health issues, coupled with regular consultations with healthcare providers, can often provide safer and more sustainable solutions. Remember to consult with a healthcare provider before making any changes to your medication regimen. In addition to the previously discussed medications, there are several others that healthcare professionals often avoid prescribing for long-term use due to potential risks and side effects. Understanding these medications and their associated concerns can help individuals make informed decisions about their health. 6. Opioid analgesics, pain relievers. Opioid analgesics, such as oxycodone, hydrocodone, and morphine, are potent pain relievers prescribed for acute pain, post-surgical pain, and cancer-related pain. While effective in managing severe pain, their long-term use is generally discouraged due to several significant risks. Addiction and dependence. Prolonged use of opioids can lead to physical dependence and addiction, characterized by compulsive drug-seeking behavior and use despite harmful consequences. The opioid crisis has highlighted the dangers of long-term opioid therapy, with many individuals developing opioid use disorder. Tolerance. Over time, individuals may develop tolerance, requiring higher doses to achieve the same level of pain relief, which increases the risk of overdose. Respiratory depression. Opioids can depress the respiratory system, leading to slowed or difficult breathing, which can be fatal, especially at higher doses. Alternative pain management strategies, non-opioid pain relievers, physical therapy, cognitive behavioral therapy, and interventional procedures can be effective alternatives for managing chronic pain without the risks associated with long-term opioid use. 7. Benzodiazepines, anti-anxiety medications. Benzodiazepines, including diazepam, Valium, alprazolam, Xanax, and lorazepam Ativan, are prescribed for anxiety, insomnia, and certain seizure disorders. However, long-term use is generally avoided due to dependence and withdrawal. Extended use can lead to physical and psychological dependence. Withdrawal symptoms may include anxiety, insomnia, seizures, and, in severe cases, life-threatening complications. Cognitive impairment. Chronic use has been associated with memory problems, decreased attention, and other cognitive deficits, which may persist even after discontinuation. Increased risk of falls. Especially in older adults, benzodiazepines can cause sedation and impair coordination, leading to an increased risk of falls and fractures. Alternative anxiety management approaches, cognitive behavioral therapy, CBT, mindfulness practices, and certain antidepressants, such as SSRIs, are effective in managing anxiety disorders without the risks associated with long-term benzodiazepine use. 8. Antipsychotic medications, mental health treatments. Antipsychotic medications, such as olanzapine, Zyprexa, and Risperdal, are used to treat conditions like schizophrenia and bipolar disorder. Long-term use can lead to metabolic syndrome. These medications can cause weight gain, elevated blood sugar, and lipid abnormalities, increasing the risk of diabetes and cardiovascular disease. Tardive dyskinesia, a serious movement disorder characterized by involuntary muscle movements which can be irreversible. Cardiovascular risks. Some antipsychotics have been linked to an increased risk of heart arrhythmias and sudden cardiac death. Alternative management strategies. For some individuals, lower doses, switching to medications with a more favorable side effect profile, or incorporating psychotherapy can help manage symptoms while minimizing risks. 9. Glucocorticoids, steroid medications. Glucocorticoids, such as prednisone and dexamethasone, are powerful anti-inflammatory and immunosuppressive agents used to treat conditions like asthma, rheumatoid arthritis, and autoimmune diseases. Long-term use is associated with osteoporosis, Chronic glucocorticoid use can lead to decreased bone density, increasing the risk of fractures. Hyperglycemia. These medications can elevate blood sugar levels, potentially leading to diabetes. Increased infection risk. By suppressing the immune system, glucocorticoids can make individuals more susceptible to infections. Alternative treatment approaches. Using the lowest effective dose for the shortest duration, exploring non-steroidal medications, and implementing lifestyle changes can help manage conditions while reducing the risk associated with long-term glucocorticoid use. 10. Anticholinergic medications. Various uses. Anticholinergic drugs are used to treat a range of conditions, including bladder issues, depression, and Parkinson's disease. They work by blocking the neurotransmitter acetylcholine, which is involved in many bodily functions. Long-term use of these medications can lead to cognitive decline. Studies have shown that prolonged use of anticholinergic drugs is associated with an increased risk of dementia and other cognitive impairments. Physical side effects. Common side effects include dry mouth, blurred vision, constipation, and urinary retention. Regularly reviewing medications with a healthcare provider, especially for older adults, can assess the necessity of continued anticholinergic therapy and explore alternative treatments when possible. While medications play a vital role in managing various health conditions, it's essential to be aware of the potential risks associated with their long-term use. Addressing the underlying causes of health issues through lifestyle modifications, alternative therapies, and regular consultations with healthcare professionals can often provide safer and more sustainable outcomes. Always consult with a healthcare provider before making any changes to your medication regimen.